being published all over the country. It generates a great deal of interesting feedback from the community. When I go back to the hospital tomorrow, I will probably sit down and write a reply to a lady who wrote to us about a week ago complaining about the crosses at the North Campus, who believes that the cross is a sign of oppression, and so I'll have a nice time writing a letter back to her. So we generally get a little bit of negative feedback, but a great deal of positive feedback from the community. Our main purpose in doing this is to simply profess who we are, and our belief is that if we can change even one mind, that it will all have been worth it. And so as I say, we now have 3 of our campuses displaying these crosses proudly. They do so throughout the month of October, and from time to time, particularly during election year, we let it run over until the first week of November. We make a practice of releasing a large number of biodegradable, in case any of you are concerned, biodegradable balloons into the atmosphere. This particular year, when this was taken, they were all white balloons. We generally have pretty good weather, as you can see. We generally release, have in the past released white balloons. We have now taken to releasing both pink and blue balloons, and there are literally 4,000 of them that go up into the air, and creates quite a sight over northwest Indiana when we do that. And as you can see, from time to time, some publications pick up the photos. The editors of America apparently felt that way. We don't hesitate to promote our mission in the community. As you can perhaps see in this ad, we put spirituality into science. At St. Margaret Mercy, we believe in the power of medicine, but we put our faith in the power of prayer. When you come to our hospital, you will find people who embody our Franciscan values of compassionate concern, joyful service, and respect for life. Whether it's one of our volunteer spiritual companions visiting your room each day, the gentle word from a priest, or the caring touch of your physician or nurse, spirituality is as much a part of the care we give as science. Put that together with some of the most advanced technology in the country, and you have a powerful force for healing. This commitment to our beliefs might make us a little bit different, but we wouldn't have it any other way. St. Margaret Mercy, good things are happening here. We generally, and we've been doing this for a number of years, long before 9/11, have a special service in honor of our police officers and firefighters. That generally occurs on the feast of St. Michael the Archangel. And we're fortunate to have a great deal of support from the public safety officials in the area who have come to regard it as a very important ceremony for them. We offer them breakfast afterwards, so a lot of them, actually it's lunch we're doing now, I think. We offer a big lunch to them after. This is our recruitment advertising. For those of you who can't see it, the tag is "Work alongside the greatest healer of all time." This is what we promote on many of our advertisements for staff, and we've had no difficulty. We have extremely low vacancy and turnover rates, generally lower than both the state of Indiana in general and the Metropolitan Chicago Healthcare Council, against which we compare ourselves. So our turnover and vacancy rates are very, very low. Volunteer Advocates for Seniors is a program that I haven't mentioned yet. This is a program for folks who find themselves in the hospital alone and incapacitated by their illness. These are folks who need to be moved to another setting, whether it be a hospice, a nursing home, or some kind of an extended care facility, one kind or another. Because they're incapacitated, they have no one to care for them. Once again, we call upon volunteers, generally our employees. They go through an extensive program to qualify to be guardian ad litem. They're qualified by the court and then are authorized to make decisions on behalf of these folks that are completely consistent with our mission and with the religious and ethical directives. So what we're doing is providing folks who we fear might not otherwise have someone who is interested in them with some assurance that they will not be forced to undergo procedures that they may not be interested in undergoing, including withdrawal of nutrition and hydration, for example. So this program, which was conceived by one of the presidents of our hospitals, Tom Grisbeck, was embraced by not only the local judicial system, the judges, as well as the local prosecutors. but he subsequently took it to the legislature in the state of Indiana and had it approved by them. It is now being adopted across the state of Indiana and has provided a great deal of comfort to folks who otherwise would be left to the mercies of the court system, which, of course, even the court system realizes is not a good idea. So we're very proud of this program as well, and it's completely consistent, again, with our mission and values. Tom, as it happens, Tom Grisbeck, the person who conceived of this program, is an ordained deacon in the Diocese of Gary. This is our latest Respect Life advertisement. This is an ad that we run during Respect Life Week, October 4th to 10th, with all of our hospital names listed at the bottom, and a listing of the various programs that we encourage folks to consider. Building a Culture of Life is our ongoing commitment. It's our banner, and we proudly wave it. This was a full-page ad that appeared in the local newspapers on the Sunday of Respect Life Week. We always do a full-page ad in the local papers at Christmas time. We endeavor to choose, in fact, we invite folks to send us a stained glass window depicting a nativity scene from one of the churches in the Diocese of Gary or within our catchment area. And we then run the ad. Our Christmas cards, too, the Christmas cards that we send out to folks are derived from this ad. So we're very pleased with that program. It's been very successful and welcomed by others. As I indicated earlier, the organization that is not only the Sisters of St. Francis, but all their system hospitals, and particularly the Northern Indiana region, embrace the religious and ethical directives for Catholic healthcare services. We do, in fact, orient all employees to the religious and ethical directives. We also orient all of our physicians to the religious and ethical directives. Everybody gets a copy of them. All of our contractual arrangements with our employees, including especially physicians, for example, and with all managed care entities and other companies that do business with us, have a clause in them which specifies that the ethical and religious directives are to be honored. This is the managed care contract language, standard language that we have. Payer acknowledges that hospital's religious affiliation is Roman Catholic and that hospital adheres to the ethical and religious directives for Catholic health facilities issued by the National Conference of Catholic Bishops and the United States Catholic Conference, as may be revised from time to time. The directives include, but are not limited to, the prohibition of euthanasia, sterilization, abortion, and other specified family planning techniques and procedures. And everybody understands, including the largest of the managed care organizations and everybody we do business with, that this is the first subject we discuss in any of our relationships with folks who want to do business with us. Anyone who wants to do any kind of business with us that might involve clinical services of any kind finds very early on that this is the first thing we talk about, our mission and what our principles mean. We have a number of recent ethical challenges, as you can imagine, including things like non-heart beating cadaveric donations. We have had a fight with the local organ procurement agency over this issue. We will not do non-heart beating cadaveric donations. That created a little bit of a problem with the federal government, which funds and supervises that agency, but when we made it clear what our position was, they backed off. Treatment of tubal pregnancies is in accord with the ethical and religious directives. We do self-injectomies, not self-injotomies. Withdrawal of nutrition and hydration is obviously an issue that we watch very, very carefully. There have been a number of controversies in that respect, but we have a very good policy that was in place actually before Pope John Paul II issued his pronouncement on the issue in 2005, and folks sometimes wonder how we knew what John Paul was going to say. Fetal care ends up being an issue. It's one that we have not encountered in our area until about the last 7 or 8 years, and it is a constant battle trying to work with folks who are determined that a patient is going to receive all the care they can, even if there's absolutely no hope of prolonging their life. It is a constant concern. Artificial contraception is banned not only within the hospital, but in all of our clinics, as well as in the pharmacies that do business with us. Not only the pharmacies that are located in our medical office buildings, but also the pharmacies that do business with us in the area if they expect to get our our employees' drug business. So we've been pretty successful in persuading them that our business in that respect is worth them than their artificial contraception business, and they've been pretty cooperative with us in that respect. Infant circumcision, by the way, has gotten to be a bit of an issue with us. We have a lady who's chasing us over that issue now, who believes that we shouldn't be doing any circumcisions. Here's our policy on management of extrauterine pregnancy. I don't think we have enough time to go over it now. We have a number of policies in this regard that are vetted first internally by our ethics folks, then by my dad, who some of you know is an accomplished bioethicist, then by the local bishop, and by the NCBC, the National Catholic Bioethics Center. And so we're pretty comfortable. They've published a number of our policies, so we're pretty comfortable that we're acting in accordance with church teaching in that respect. Withholding and withdrawing of hydration and nutrition got me into trouble in my very earliest days at St. Margaret Mercy. Shortly after I became the president and CEO, I got myself involved in a situation where family members were very interested in withdrawing nutrition and hydration on a patient who wasn't dying, and I ended up stopping that, and there was a huge controversy in the community which lasted for a number of weeks, including on the front page of the paper, but we got past it. As I think I may have indicated earlier, but perhaps not, we are neither triumphalistic in our practices, nor are we pietistic. We simply engage the culture where we find it. That's part of our Franciscan tradition. And so in the middle of the Terri Schiavo situation, I was asked to give an interview to the local newspaper, and was happy to do so, but it resulted in the headlines you can see, and a great deal of controversy as well. But it engendered a great deal of support in the community as well. A number of folks who said they felt better that they weren't going to be terminated when they came to Warren Hospital. Engaging the culture has also involved my having to tell some of our physicians who are employees of ours that they were no longer going to be able to work for us because they were administering artificial contraception without our knowledge, without our permission. And they decided to take that to the local newspaper, and there's quite a bit of controversy associated with this, but believe it or not, in the final analysis, the local paper editorialized that we were within our rights to do it, believe it or not. They took the position that they didn't take a position in favor of our contraceptive position, obviously, but they did take a position in favor of our having the right to administer our contractual relationships as we saw fit, and with the full knowledge of those physicians. So we were pleased to have at least some support in the public for that. This is something new, and I'm not sure I've shared this with you before, Steve. Years ago, we began to become more acutely aware that a large number of women who were losing their babies to prematurity or to stillbirth were forlorn because, as is the practice, and some of you may be more familiar with this than I am in your own areas, generally with very early pregnancies, there is a disposition of remains which occurs fairly anonymously in consecrated ground in the local Catholic cemetery. But there are many cases where the mother of the child that is delivered in our hospital is a stillbirth or is very premature, don't want to have anything to do with the remains. And these include people, obviously, of other faith traditions.